Understanding Myasthenia Gravis, a comprehensive guide for patients. Are you experiencing unexplained muscle weakness or fatigue? It could be Myasthenia Gravis. Let's explore this condition together. Myasthenia Gravis, MG, is a chronic autoimmune neuromuscular disease. It causes weakness in the skeletal muscles, which are responsible for breathing and movement. Understanding MG is the first step in managing it effectively. MG disrupts the communication between nerves and muscles. This disruption leads to the characteristic muscle weakness and fatigue. It's important to recognize the symptoms early for timely diagnosis and treatment. MG symptoms can vary significantly from person to person. The severity and specific muscles affected can differ. Recognizing these symptoms is crucial for early detection. Muscle weakness is a primary symptom, affecting arms, legs, and neck. Fatigue often accompanies this weakness, worsening with activity. These symptoms can significantly impact daily life. Droopy eyelids, ptosis, and blurred or double vision are common. Limited facial expressions and difficulty speaking or swallowing can also occur. These symptoms can affect communication and eating. Trouble walking and general fatigue are also indicative of MG. Muscle strength often fluctuates, being better in the morning and worsening as the day progresses. Recognizing these patterns is important. In rare cases, MG can affect the respiratory system. Shortness of breath or serious breathing problems require immediate medical attention. Contact emergency services if you experience breathing difficulties. Autoimmune MG occurs when the immune system attacks itself. The body mistakenly targets healthy tissues. Researchers are still investigating the exact reasons for this immune system malfunction. The thymus gland may play a role in autoimmune MG. Immune system cells in the thymus may struggle to differentiate between threats and healthy components. This can lead to the production of harmful antibodies. Congenital MG is caused by genetic changes. Neonatal MG results from antibodies passed from mother to fetus during pregnancy. These forms of MG have different underlying mechanisms. MG disrupts the communication at the neuromuscular junction. This is where nerves and muscles communicate. Understanding this process is key to understanding MG's effects. Nerves send signals to muscles via a neurotransmitter called acetylcholine. Acetylcholine binds to receptors on muscle cells, triggering muscle contraction. This process is essential for movement. In MG, antibodies block or destroy acetylcholine receptors. This prevents the signal from reaching the muscle, leading to weakness. The communication pathway is disrupted. Imagine a baseball game where the pitcher, nerve, throws the ball, acetylcholine, to the catcher, muscle. In MG, the catcher's glove, receptors, is damaged, making it hard to catch the ball. This analogy helps visualize the disrupted communication. Autoimmune MG is rarely inherited. Congenital and neonatal MG can be inherited. Understanding the genetic aspects can be important for family planning. Inherited forms of MG usually follow an autosomal recessive pattern. This means both parents must carry the gene for a child to develop the condition. Genetic counseling can provide more information. MG is more common in women around age 40 and men after age 60. However, it can affect anyone at any age. Being aware of risk factors can help with early detection. A history of other autoimmune conditions increases the risk. Thyroid disease is also a potential risk factor. Discuss your medical history with your doctor. Certain medications, surgery, and infections can trigger MG symptoms. Malaria and heart arrhythmia medications are examples. Be aware of potential triggers. Weakness and fatigue can limit participation in enjoyable activities. This can lead to stress and depression. Maintaining a positive outlook is important. Myasthenic crisis is a severe complication involving respiratory muscle weakness. It requires immediate medical intervention, including possible respirator use. Recognizing the signs of a crisis is crucial. Up to 20% of people with MG experience a myasthenic crisis. Prompt treatment can be life-saving. Be prepared and know when to seek emergency care. The thymus gland often plays a role in MG. It's part of the lymphatic system and produces white blood cells. Abnormalities in the thymus can contribute to MG. Many MG patients have thymic hyperplasia, overactive thymic cells. Some have thymus gland tumors called thymomas. These conditions can trigger or worsen MG symptoms. Thymectomy, surgical removal of the thymus gland, is sometimes recommended. This procedure can help improve MG symptoms in some patients. Discuss this option with your doctor. Diagnosing MG involves a thorough medical evaluation. This includes a review of your symptoms and medical history. Several tests can help confirm the diagnosis. A neurological examination assesses muscle strength and reflexes. Blood tests can detect the presence of acetylcholine receptor antibodies. These tests are crucial for diagnosis. Hydrophonium test, tensilin test, involves injecting a medication that temporarily improves muscle strength. This can help confirm the diagnosis. Repetitive nerve stimulation tests can also be used. Single fiber electromyography, SFEMG, is a sensitive test that detects impaired nerve muscle transmission. It's often used when other tests are inconclusive. Early and accurate diagnosis is essential for effective management. MG treatment aims to improve muscle strength and reduce symptoms. Treatment plans are individualized based on symptom severity and overall health. A multidisciplinary approach is often used. Medications such as cholinesterase inhibitors can improve nerve-muscle communication. Immunosuppressants can reduce the production of harmful antibodies. These medications help manage symptoms. Thymectomy may be recommended, especially if a thymoma is present. Plasmapheresis and intravenous immunoglobulin, IVIG, are short-term treatments for myasthenic crisis. Discuss all treatment options with your healthcare team. Lifestyle adjustments can also help manage MG. Getting adequate rest, avoiding triggers, and managing stress are important. Physical therapy can help maintain muscle strength. Living with MG requires proactive management and self-care. Support groups and patient organizations can provide valuable resources. Connecting with others can help you feel less alone. Plan your activities to conserve energy. Use assistive devices if needed. Communicate openly with your healthcare team. These strategies can improve your quality of life. Maintain a healthy diet and exercise regularly, as tolerated. Avoid extreme temperatures and stressful situations. These lifestyle adjustments can help manage symptoms. Stay informed about MG and its management. Advocate for your healthcare needs. Empower yourself with knowledge and support. ###